In this video, we will address antibody testing for COVID-19, exactly how it works and what the results imply for us. First and foremost, antibodies are proteins made by the immune system to fight infections like viruses and may help to ward off future occurrences by those same infections. Antibodies can take days or weeks to develop in the body following exposure to COVID-19 infection, and it is unknown how long they stay in the blood. Before mentioning what a COVID-19 antibody test is, it is worth noting that an antibody test does not detect the presence of the SARS-CoV-2 virus to diagnose COVID-19. These tests can return a negative test result even in infected patients or may generate false positive results, so they should not be used to evaluate if you are currently infected or contagious. False positive tests may occur as it can detect coronaviruses other than SARS-CoV-2, such as those that cause a common cold. Also, when testing is done in a population without many cases of COVID-19 infections, false positives may arise due to low infection rates. The types of diagnostic tests for COVID-19 will fall into two categories: molecular tests and antigen tests. Molecular tests detect the virus's genetic material and are used more commonly than antigen tests. Antigen tests help detect specific proteins on the surface of the virus. Both of these are performed using samples taken mostly from the nose and throat, using a lung swab or other respiratory specimens. A COVID-19 antibody test, also known as a serology test, is a blood test that can detect if a person has antibodies to SARS-CoV-2, the virus that causes COVID-19. COVID-19 antibody tests can help identify people who may have been infected with the SARS-CoV-2 virus or have recovered from the COVID-19 infection. If you receive a negative result on a SARS-CoV-2 antibody test, this means antibodies to the virus are not detected in your sample. It could mean you have not been infected with COVID-19 previously. You had COVID-19 in the past, but you did not develop or have not yet developed detectable antibodies. It is unknown if all infected individuals will develop a detectable antibody response. At this time, researchers do not know whether the presence of antibodies means that you are immune to the coronavirus in the future, or if you are immune, how long it will last. In the case of antibody testing, the terms sensitivity and specificity are often used hand in hand, along with positive predictive value. Sensitivity is the ability of the test to identify people with antibodies to SARS-CoV-2. This is known as a true positive rate. A highly sensitive test will identify most people who truly have antibodies, with few people with antibodies being missed by the test or false negatives. Specificity is the ability of the test to correctly identify people without antibodies to SARS-CoV-2. This is known as a true negative rate. Highly specific tests will identify people who truly do not have antibodies, with few people without antibodies being identified as having antibodies by the test, or false positives. The positive predictive value is a barometer that reflects the likelihood that a positive test result correctly indicates the presence of the disease. This is used to know more about the population that's studied and whether those people are comparable to the people who would be tested in the real world. We hope this video will help your understanding of antibody testing and its implications. Stay safe and thank you.